7 surprising signs of fertility in women you might just be missing. Did you know that your body might be sending you secret signals that you're at your most fertile, and you might have just been missing them out completely? Every month, your body goes through subtle changes that could tell you exactly when to conceive, so you know exactly what to look out for. So in today's video, I'll be breaking down 7 surprising signs of fertility in women that will help you to know exactly how to time sex right if pregnancy is the goal. All right, and number 4, trust me, is a game changer. It's going to change exactly the way you track your cycle forever. Let's get into it. Hi everyone, my name is Ovelation. Welcome back to my channel where we discuss everything reproductive health with emphasis on fertility and women's wellness. So to all my returning subscribers, thank you so much for being here. If today your first time of being here, I appreciate you so much. Welcome to this channel, Good Life Diary, and please do hit on that subscribe button and let's get started. So first, what is fertility? Let us define the topic at hand. If you've been following me, you agree with me that we'll first of all define the topic at hand before getting into the real business of the day. So what is fertility? Fertility in simple terms is simply a woman's ability to conceive and have a child. And every month a woman is fertile, is most fertile at specific windows in her menstrual cycle, typically around the time of ovulation, which is when an egg is released from an ovary. So what are the signs of fertility you need to be looking out for every month? Number 1 is changes in cervical mucus. Cervical mucus is like the medium that transports the sperm to go and mix with the egg, and this is what that creates a favorable environment for the sperm needed for the sperm to swim successfully to meet the egg. And sometimes some of the people that have been trying to conceive for some time, part of the problem they have is hostile cervical mucus. I'm not supposed to be adding this here, but let me put it. Some people have done so many tests they are supposed to do in the hospital, from infection to HSG to all of them. They have gone through almost all the tests and they've been certified okay. Some of them, their problem is the cervical mucus. You get towards the time of ovulation, the cervical mucus begins to change, looking like a clear slippery fluid. It's supposed to look like raw egg white. Yes, but some people, the problem they have been causing them inability to conceive is called hostile cervical mucus. The cervical mucus is too harsh, the pH is not appropriate. They tend to kill off sperm cells once they get in contact with the sperm cell. So I want to add that some people even trying for a baby and you've been certified okay. Could it be that you are having hostile cervical mucus? And part of the things I recommend that I know have worked for a couple of persons I know is trying to get a fertility friendly lubricant. Just maybe something wanted me to actually say this to you, okay? I feel it's going to benefit someone in particular because I've recorded this particular part of this video and it didn't have a sound. I found out that my microphone died along the line, so I had to bring my another microphone and start recording it. So this is the important part you need to pick from this, okay? If you've been trying to conceive for a while now and doctor have certified that you're fine, try getting a fertility friendly lubricant so as to rule out hostile cervical mucus. And a fertility friendly lubricant I know is Proceed by Carrot Stop Drugs. All right, so you can try getting them from a pharmacy, or to be on the most safe side, on your next appointment with your doctor, tell him you heard about Proceed fertility lubricant. Let him know how safe it is for you to use it, so you don't use anything that is not prescribed for you by your doctor. So back to the main business. Another sign of fertility you need to be watching out for is changes in basal body temperature. As around the time of ovulation, first of all, what is basal body temperature? This is the temperature of your body just before you get out of bed, kind of your early morning body temperature. All right, towards the time of ovulation, there is a slight rise in basal body temperature, indicating that ovulation is around the corner. It has a special thermometer for taking note of this temperature. It's not the regular clinical thermometer. It's called a basal thermometer. All right, you can use it to keep track, to keep record of your basal body temperature in order to be sure that ovulation is around the corner. Towards that time of ovulation, your basal body temperature is likely to increase by 0.5 to 1 degree Fahrenheit. Though this is not a very reliable method, but it is equally a sign. If you are able to keep track of it, it's going to offer you a whole lot. So the third sign, fertility sign, is this ovulation pain. This is a mild kind of pain that happens around the lower abdomen. It happens just on one side of your lower abdomen. This kind of pain is called Michel's. So I hope I got that pronunciation very well. It happens on just one side of your abdomen, indicating that ovulation is just around the corner. Okay, if you've seen my video on how to pre-select the sex of your child, this ovulation pain is a guide, so that if you're trying for a baby girl or if a baby boy, this ovulation pain has a way of telling you the most appropriate time for you to do your. We are gradually getting into the more interesting part of it. So the number 4 that I talked about is increased libido. Nature knows exactly how to make you have intercourse or have sex at the most appropriate time in order to make sure that conception take place and ensure continuity of life. That is the goal. All right. So increased libido can sometimes be a sign of ovulation. You're beginning to have that increased sex drive, and if you're not trying for a baby, stay clear. All right. So if you're getting this increased sex drive alongside other symptoms I've mentioned earlier, such as the increase in basal body temperature, the ovulation pain, and the changes in cervical mucus, alongside increased sex drive, it could be an eye opener. It could be telling you, girl, if you have an ovulation prediction kit, you can test it right now. You might get a double line to tell you that this is the best time for sex. So increased libido is equally one of the things that comes with ovulation. Another sign is, which is the number 5, is breast tenderness. This ovulation it goes with a whole lot of hormonal fluctuation, especially when it has to do with estrogen and prolactin and even progesterone. All right, as at the time of ovulation, some women tend to get sore and tender breasts, trying to tell them that ovulation, something is happening, because as your body is trying to prepare for pregnancy, is going alongside hormonal changes. So breast tenderness is one of, if your breast suddenly feels sore, somebody mistakenly hits you, or you mistakenly hits your breast against somewhere, and you don't usually feel pain before, but you just got this mild pain, it could be a sign of ovulation. I always recommend ovulation prediction kits because it will help you to be more precise. So if you're trying for a baby, you can test. One pack comes with about 5 to 6, 5 to 7 in a pack, depending on the brand you're purchasing from. So it could help you to always be more precise. So heightened sense of smell and higher sensitivity to touch is the number 6 sign I'll be talking about today. It's equally accompanies ovulation. Some women, they begin, where are they cooking their love rice? Some women have increased sensitivity to smell, increased sensitivity to touch. Some people, they become irritable. Some people become more pleasant as around that time. It goes with its own packages. So heightened sense of smell and increased sensitivity to touch is a package of ovulation. It could be a sign of your fertility. That is one of the things your body might be telling you. Have you been ignoring some of these signs? Start watching out for it now, especially if you're trying for a baby. The 7th sign today is, which is not so common, but it happens. It happens is pinkish discharge, or let's call it light spotting. Some women experience this pinkish discharge on their underwear as around the time of ovulation, indicating that your egg is breaking off from its follicle. It could be a sign of ovulation for some women, though I don't think this is common. All right, so have you been watching me up to this point? Please. I'm having more of viewers than the number of subscribers I have. Please, if you come across my channel, please, if you see my video, please subscribe. We're still on a journey. We're still on a journey, so that your presence here is going to matter to both you and I. Please, I beg on you to please subscribe, especially if you got value from this video. Subscribe, like this video. As you like the video, it helps the algorithm to push it to more people, so that more people get to see the video and it becomes mutually beneficial. I will benefit from your presence here while you equally benefit from learning one or two things from here, because I promise to always bring value to the table. So long as you're here, you must learn something very beneficial, especially if you're trying to conceive. All right. So how do you keep track of all these signs? A lot of people swear by some fertility apps. Let me know if you would like me to recommend any fertility app for you, especially the ones I know that have worked. If you don't know of any, let me know in the comment section so that I'm going to recommend one for you. So you can keep track of some of these signs, because you don't just conclude with changes or signs you saw in just 1 month. In order to be more precise, in order to be more accurate, it is best to track your cycle for 3 to 6 consecutive months. That way, you must have studied a particular pattern in the changes that happen in your body, so that you can be able to say, this is not something that just happened. This is truly a fertility sign, so that you work on it. So you can download an app, a good number of apps out there that you can download and use to keep track of them. Equally, your basal body temperature, you can equally document it in that app, or a diary. I don't know the one you prefer to use, but I think an app that is always in your phone will be more handy. All right. So pay attention to these changes in cervical mucus that I've been talking about. Remember, the appropriate cervical mucus that helps your the sperm cells to travel and survive the appropriate length of time and very well is that one that looks like egg white in consistency. I'll be drop the picture if I find one. In most times, if you stretch it, it is stretching. Finds it difficult to cut. Not that one that before you stretch out your hand, it has cut. No, it is stretchy like raw egg white in color. All right, keep track of these cervical mucus changes, and definitely you will pin it down to this particular one I'm looking for. And I want to equally talk about the ovulation prediction kit too. Always incorporate it. If you're tracking this, get an ovulation prediction kit. It is going to help you, because once you get that LH surge, ovulation is around the corner and the timing is plus or minus 36 hours. But the only downside is that you do not know how fast spent the 36 hours has gone. You don't know whether you're in the 35th hour, for example. So just start timing sex or intercourse accordingly if you're trying for a baby. So when is that best time to see your doctor? If you've been trying to conceive for over 12 months now, if you're younger than 35 without success, or you're older than 35, you can try for us up to 6 months and you've done that without success, I think it is the best time for you to schedule an appointment with your fertility specialist, with your gynecologist, whether you're seeing these signs or not, whether they are absent or not, because some people don't even have any sign at all, though they are in minute amount anyway. Some people must surely get one, even if it's this ovulation pain. Yes, so if you have tried for this length of time without success, it is that time for you to schedule an appointment with your doctor, so that they will assess you properly and critically and give you a diagnosis. All right. In conclusion, if you're watching me, ensure you are subscribed. Ensure you are subscribed and turn on that notification bell, so that each time we make a new video, we are going to carry you along. In conclusion, so understanding your body is one step towards taking charge of your reproductive health, whether you're trying for a baby or you simply want to better understand your body. I'm sure this video must have provided a great guideline for you. So thank you so much for watching, and I'll see you in my next one. Be sure you're subscribed. Thank you.